Welcome to this informative video on lupus nephritis, a serious kidney complication arising from the autoimmune disease, systemic lupus erythematosus, often simply called lupus. We'll explore what it is, why it happens, and how it's managed, providing a comprehensive overview to enhance your understanding of this condition. Lupus nephritis is not caused by an infection or a direct injury to the kidney. Instead, it's an autoimmune disorder. In lupus, the immune system, which normally defends the body against foreign invaders, mistakenly attacks healthy tissues and organs, including the kidneys. The exact trigger for this autoimmune response remains unclear, but genetic predisposition, environmental factors like sunlight exposure or certain medications, and hormonal influences are believed to play a significant role. The pathophysiology of lupus nephritis is complex. The autoimmune attack leads to the formation of immune complexes, clusters of antibodies and antigens that deposit in the glomeruli, the filtering units of the kidneys. These deposits trigger inflammation and damage, disrupting the kidney's ability to effectively filter waste and excess fluid from the blood. Over time, this chronic inflammation can lead to scarring known as glomerulosclerosis and ultimately kidney failure. Lupus nephritis affects a significant proportion of individuals with systemic lupus erythematosus. Studies suggest that up to 60% of adults and as many as 80% of children with lupus will develop some form of kidney involvement during their disease course. It's more prevalent in certain ethnic groups, particularly African Americans, Hispanics, and Asians. Women are also significantly more likely to develop lupus and, consequently, lupus nephritis than men. The symptoms of lupus nephritis can be subtle in the early stages, making early detection challenging. Common signs include proteinuria, the presence of protein in urine, hematuria, or blood in the urine, edema, swelling in the legs, ankles, and feet, high blood pressure, and in severe cases, kidney failure symptoms like fatigue, nausea, vomiting, and loss of appetite. Not everyone experiences all of these symptoms, and some may have symptoms that are easily overlooked. Diagnosing lupus nephritis typically involves a combination of blood and urine tests. Urine analysis can detect proteinuria and hematuria. Blood tests assess kidney function, such as creatinine and blood urine nitrogen in BU levels. Further, immunological tests are used to detect specific autoantibodies associated with lupus, such as anti-dsDNA antibodies and anti-Smith antibodies. A kidney biopsy, where a small sample of kidney tissue is examined under a microscope, is often essential to confirm the diagnosis, determine the severity of the kidney damage, and guide treatment decisions. Lupus nephritis is classified into different types based on the findings of the kidney biopsy. The World Health Organization (WHO) classification system is commonly used and includes classes I through VI. Class I is minimal mesangial lupus nephritis, often with mild or no symptoms. Class E is mesangial proliferative lupus nephritis. Class E is focal lupus nephritis, affecting less than 50% of glomeruli. Class IV is diffuse lupus nephritis, affecting more than 50% of glomeruli and considered the most severe form. Class V is membranous lupus nephritis. Class VI is advanced sclerosing lupus nephritis, indicating chronic, irreversible kidney damage. This classification helps doctors tailor treatment strategies based on the specific type and severity of kidney involvement. The primary goal of lupus nephritis treatment is to reduce inflammation and prevent further kidney damage. Treatment typically involves a combination of immunosuppressant medications, such as corticosteroids like prednisone, and other medications like mycophenolate mofetil or cyclophosphamide. Angiotensin-converting enzyme ACE inhibitors or angiotensin receptor blockers (ARBSA) are often used to control blood pressure and reduce proteinuria. In severe cases of kidney failure, dialysis or kidney transplantation may be necessary. While there's no guaranteed way to prevent lupus nephritis in individuals with lupus, several strategies can help reduce the risk and slow its progression. These include adhering to prescribed lupus medications to control the underlying autoimmune disease, regularly monitoring kidney function with urine and blood tests, managing blood pressure effectively, maintaining a healthy lifestyle with a balanced diet and regular exercise, and avoiding nephrotoxic substances like certain pain relievers or contrast dyes used in imaging procedures. Early diagnosis and prompt treatment are crucial for preserving kidney function. The prognosis of lupus nephritis varies depending on the severity of kidney involvement, the response to treatment, and the presence of other health conditions. Early diagnosis and aggressive treatment can significantly improve outcomes. However, some individuals may still progress to end-stage renal disease requiring dialysis or transplantation. Recent research is focused on developing more targeted therapies that specifically address the underlying autoimmune mechanisms driving kidney damage. New biologic agents and personalized treatment approaches hold promise for improving long-term outcomes and reducing the burden of this challenging condition. Researchers are also exploring biomarkers that can predict disease flares and treatment response, allowing for earlier and more effective interventions. The future of lupus nephritis treatment is bright, with ongoing research paving the way for better therapies and improved patient outcomes.